Um, Dr. McLaughlin, at your request, you have been subpoenaed to testify. Your testimony is being given under oath. Do you understand that the testimony you give today will be truthful and that your testimony will be recorded?
Yes.
Thank you. Although the proceedings will be recorded, we will not be making a transcript unless one is requested, and the cost of reproduction are paid by the person requesting it. With that, I'll open the hearing to questions.
Good afternoon, Tina.
Hi.
As we are asking of all people that are attending this briefing, we wanted to get a sense of the cuts in services and changes in organization, and from your perspective as a provider or in other people's cases as a consumer, how has that impacted your clients?
The cuts in services began actually in 2008 with the closure of the Assertive Community Treatments program. And those consumers were the consumers who were actually at a hospital level of care but could be maintained in the community with a significant amount of support through a national model of treatment. Those consumers were all transferred into community-based case management programs, and they and providers were assured that they would receive intensive and high level of service in those programs. Then the community-based case management program was significantly cut in January of 2009. And it was actually, we were cut from doing about, I think it was about 16 hours of service per month down to about 3.5 hours of service per month. And the cut was made initially without regard to the level of acuity of need of the consumer. And then we were allowed to request additional services on a person-by-person basis as the need might arise, and that has occurred. So some individuals who are in need of more service have been able to get those services, but not all. Then further cuts were made to the crisis program. We operate the crisis services for the islands of Kauai, Oahu, and Hawaii. And the cut that was made there was for the crisis stabilization management service, and instead of being able to provide stabilization management for 30 days post-crisis, we were limited to 5 days and to about 4 hours of service instead of 16 hours of service. And during those 5 days, linkage was supposed to occur for those consumers into the system who needed further follow-up care. That was implemented in December of last year, December 1st of last year. And the results of that have been that about 10 to 15% of these consumers have not adequately been linked prior to discharge from the Crisis Stabilization Management Program. In terms, then another program was cut. The Psychosocial Rehabilitation Program was also cut in December. And those consumers who were receiving those services were not receiving any services of that type. And in our case, we started trying to run some groups for those consumers that's funded who had insurance. But instead of being able to serve approximately 80 consumers, we ended up being able to serve only about 20 because of the economics of the situation. In terms of tracking the impact of this, we were tracking Sentinel events and comparing 2008 to 2009. for deaths, whether the death was a medical death, a homicide, or a suicide. And there was about a 36% increase in 2009 of deaths, most of which were medical deaths. And we believe that's due to the fact that many consumers have multiple medical problems and need support in accessing medical services, and with the limitation in services, they were not able to access services in a timely fashion and were more susceptible to severe events.